Hello, everybody. Welcome to Ask Dr. Bob. And this is where you get to ask me, Dr. Bob Gebe, the Chief Scientific and Medical Officer here at the American Diabetes Association, your questions about diabetes. And for those of you that are new to the show, each month we pick a theme. And this is American Heart Month. So we're going to talk about heart disease and cardiovascular disease for people with diabetes. Um, if you enjoy this show, please tell your friends. Also, follow me on LinkedIn and Facebook, where I'll be sharing lots of other useful information to help you and your loved ones live a healthy life with diabetes. So, let's look at the questions we have for American Heart Month, and it starts with really sort of basic question, which is a good starting point. How does diabetes affect one's cardiovascular health? And so here's something that not everybody appreciates is that guess what the number one killer is for people living with diabetes? It's cardiovascular disease. And so that's why this is such an important episode. And it turns out that having diabetes increases your risk of developing heart disease 2 to 4 fold, 2 to 4 times more likely to have heart disease. And that's because of a variety of different reasons, which we will get into in a moment. So there's a very strong link, and we'll be spending the rest of this session talking about it. So next question is how do blood glucose levels affect one's risk of cardiovascular disease? And yes, it very much does. Uh, the higher your blood glucose levels, the more likely to have heart disease. The good news is um, with better and blood glucose values in range, you lower your risk of heart disease. Uh, and so it sort of brings up what are the risk factors for cardiovascular disease for people with diabetes, and some of them are the same risk factors as everybody else. So, having high blood pressure, cholesterol issues, those are true for people without diabetes. And because um, cholesterol issues and blood pressure are more common in people with diabetes, it becomes even more of an issue. Smoking increases your risk of heart disease. We'll talk about in a moment of family history and how that can increase your risk. Um, and then here's one that maybe may not have thought of is if you have diabetes and you have some kidney disease, your risk of heart disease goes up even higher. So these are all the risk factors: cholesterol, blood pressure, uh, being male increases one's risk of heart disease, smoking, and again, chronic kidney disease. So then the next question is, so what are the other effects of high blood glucose on cardiovascular disease? And here I think they're getting at other blood vessels, and I'm glad that you asked that question. So you know, heart disease, let's just start there, is largely what we'll call atherosclerotic heart disease. So you think of the heart beating, it needs an energy supply. That energy supply is the blood flow. There are arteries around the heart that provide the nutrients for the heart to keep beating all the time. Those tiny blood vessels get clogged. And when they clog, that is when people can have chest pain uh, or an actual heart attack when they clog completely and the tissue that they supply no longer has blood flow, no longer has nutrients, no longer therefore has oxygen. And that's what a heart attack is when those coronary vessels get clogged. And they're not the only vessels that can get clogged. There's also the vessels in the legs. And when that happens, it's called peripheral, which is the periphery, your legs being affected. Peripheral arterial disease, the arteries in the periphery get affected. And the reason that's important is that is one of the reasons why people with diabetes get amputations. So they're more likely to have that clogging of the arteries in the peripheral, develop peripheral arterial disease, and that can lead to an amputation. And so, one of the questions are what are the things in the standards of care around this? And I want to take a moment since we're talking about peripheral arterial disease to talk about this because this is a brand new update in what the American Diabetes Association produces, the global guidelines for clinicians on diabetes. So your healthcare professional is reading this information, but you should know it too. So here's what you should know for peripheral arterial disease to prevent amputations. Uh, uh, that if you have diabetes and any other complication of diabetes, uh, and you're over age 55, you should get a test to see if you have peripheral arterial disease because you may not know it. And that test is something called an anchial brachial index. And so, what it is very simply, it's comparing the blood pressure in your arm, where you normally are used to getting your blood pressure done, and comparing that to the blood pressure in your legs. And they should be the same, but if they're not, then there's some clogging of the arteries in your legs. So, important to get screened for peripheral arterial disease. Okay, let's move to the next question. We've talked about some of the risk factors for cardiovascular disease, uh, and that people with diabetes are a much higher risk. We talked about peripheral arterial disease and how we should be screening for that. So here's the question that I really like is, well, okay, so all these things can happen, but what can I do about it? And there's a lot that can be done. Uh, and it's really about at the simplest level, I'll say it's the ABCs. So getting your A1C, that measure of your average blood glucoses over the last 3 months. So getting the A1C, that's the A. The B is blood pressure, getting your blood pressure in a healthy range. And we'll talk in a second. I'll tell you what that range is. So it's A, A1C, B, blood pressure, C, cholesterol, and getting your cholesterol in the right range. So what is the right range, you may ask? Well, this is also information that is relatively new, so it's important to know. For your blood pressure, the goal blood pressure is to get to less than 130 over 80. So that's lower than it used to be recommended because we know that that low is healthier. So I'm going to say that again. Your two numbers of your blood pressure, 130 over 80, and having that. And so for many people, that's going to take medications to control their blood pressure to that level. But if you could do that, you really lower your risk of heart disease. So A1C, blood pressure less than 130 over 80, and then cholesterol. So cholesterol, probably the most important number for you to know about your cholesterol. And if you look at your lab test, look for this number. It's the LDL cholesterol. That's the bad cholesterol. And that's what we really focus the most on. And it's getting that LDL cholesterol to a healthy range. And so, what is that range? Well, again, this is where there have been some changes recently. And so, if your healthcare professional doesn't know, you can let them know and have them check the standards of care because we want you to be empowered to take care of your health. So, LDL, uh, if you have diabetes and you have other risk factors of heart disease, high blood pressure, cholesterol, obesity, kidney disease, smoking, those kinds of things, your LDL cholesterol should be less than 70. 70, that's a pretty low number. And if you have diabetes and already have heart disease, you've had a heart attack, for example, or a stroke, uh, that LDL should be less than 55. So really a low number, and that's going to require medications. But we know that people that do that are much less likely to have a heart attack or stroke. So very important to keep that in mind. The ABCs. Okay, let's see what other questions we have. Uh, so here's one. What is the role of physical activity? And it really is super valuable. And again, start wherever you are and just try to do a bit more. But if we could package exercise in a pill, it'd probably be the most effective medicine we have. Like exercise helps everything. It helps your A1C, it helps your blood pressure, it helps your cholesterol, it lowers your risk of heart disease, it lowers your risk of peripheral arterial disease, all of that. So think about what you can do to exercise a bit more. Doesn't have to be like going to a gym and doing anything extreme. It could start with just walking and walking further and walking a little faster. And there are great studies to show that when people do that, they lower their risk a great deal. So we've covered a lot of ground here, and people often say, "Well, I want to learn more," and so where can I go for more information? Well, I've got a great website uh, uh, with the American Diabetes Association and the American Heart Association. We've partnered together to raise awareness about heart disease in people with diabetes. And the website is No Diabetes by Heart, KNO, like No Diabetes by Heart .org. Go to that website. There's a ton of information. Everything I talked about is on there, plus a lot more. And then we have a monthly program called Ask the Experts that is geared towards people living with diabetes and those that care for them. And then that's at our diabetes.org website, diabetes.org/experts. And that's Ask the Experts, and you get lots of good information there. So I covered a lot of ground here around the connection between diabetes and heart disease, what those risk factors are, what you can do to prevent developing heart disease, also about peripheral arterial disease and the importance of having a screening test, an angular brachial index. And so please share this information with those that you know with diabetes or care for someone with diabetes. Uh, join me on LinkedIn and Facebook for lots more information about this and other things, and tell your friends around this Ask Dr. Bob show. So with that, take care and be well, and we'll see you next time.